Hello and welcome you all to the CRISP TV. Today is the first day at the CRISP 2024 conference, and I'm your host, Abad Khan. I'm an interventional cardiologist practicing at St. Joseph Hospital, Hyderabad. And today we have a special guest, Dr. Pradeep Vaideeswar. He is a professor in the Department of Cardiac Pathology at Medical College, Mumbai. Sir, welcome to the CRISP TV.
Thank you.
Sir, it's a difficult thing to pull off what you have done, sir. Cardiopathologist, he was often known as the lost man in the crowd. Sir, it's an atypical scenario when the samples or tissues of the pathologist are sent to a pathologist. It's usually to make a definitive diagnosis for that person to make him feel better or give a proper treatment. But for a cardiac pathologist, that's not the same scenario. Once you receive the specimens, you have to deal and teach people in such a way so the whole subset of disease gets treated. Except a few samples, maybe for endomyocardial biopsies or for heart transplant patient biopsies. So, how does it feel? How does it feel to be absolute in a different subset of and teaching different maybe people also, maybe surgeons, maybe cardiologists?
Right. So, unfortunately, cardiovascular pathology is a very non-glamorous type of subspecialty. And there are not too many people who opt for cardiac pathology as a subspecialty after they have pursued their MD degree in the same subject. And unfortunately, most of the cardiovascular pathology in most of the countries is not only in India but also abroad. Much of that pathology is based on autopsy specimens. And these autopsy specimens are not from the clinical autopsies, but more from medico-legal autopsies. And luckily for us, because of so much advances which are done both in cardiac surgery as well as in cardiology, now we have started getting good specimens, surgical pathology specimens, even in this particular field, especially like aortic resections, then valvectomies, and of course the cardiac tumors. That also has started rising because of more amount of detection. Incidental detections also are there. So now I think cardiovascular pathology is becoming slightly more popular than it was when I took up this subject 35 years ago.
Great, sir. Understanding anatomy and hence pathology via specimen, it takes understanding to an absolutely different level.
Yes.
Like for an interventional cardiologist, we were just at a talk. For an interventional cardiologist who wants to plan a device closure for an ASD, understanding its relation to the aorta, understanding its relation to the mitral valve, to the aortic valve, what is posterior, what is anterior, and they are able to foresee the complications and treat them better when they are doing the procedure, and which is absolutely unmistakably better once you have a 3D picture in your head, once you have learned that. So do you believe that not only for that MD pathology going on for subspecialties, people who are dealing with the cardiac diseases like the cardiologists or the CT surgeons, should they spend a few more days of posting till the time a specialty is developed in the cardiac pathology department across India to make the intervention safer and better?
Definitely, because cardiovascular pathologist is not for pathology at all. Cardiovascular pathology is more from the clinicians, for the cardiologists as well as cardiac surgeons. And once again, if I can make a reference for example, in USA, the cardiologists and all do spend some time with the cardiac pathology department and look at the specimens and try and understand what can go wrong or what went wrong and how they can further prevent all the complications which can occur. So I really feel, at least if you know, a 2 weeks rotation of cardiologists and cardiac surgeons with the cardiac pathologists will make a definite improvement in patient care.
So that is a very important point Dr. Pradeep Vaideeswar has spoken about. And we as cardiologists, as well as I've spoken to surgeons also, we strongly believe that having an understanding of the pathology via the specimen can be a great tool. So now that you have seen everything and taught us everything, given a great lecture also, what's the impression of this CRISP conference? What do you see changing in future after the focused attention has started on the absolute conceptual basics? Like, what's your understanding of this CRISP and how do you see it?
Yeah, the only problem which I see is that somehow we have lost touch with the ground level and we are doing more and more innovations without understanding the basic anatomy. So somewhere I feel that basic anatomy should be interwoven with all the innovations that are being done. That is my personal impression.
So perfect closure to that innovation is absolutely important, but do not lose your basics. And besides that, sir, a few rapid fire questions. You have to just say whatever you like. This will be not part of the academic program we are doing. So what is more joyful to work with, teaching or traveling?
Teaching.
Great. So what's worse, Mumbai rains or Mumbai traffic?
Boots.
And what do you love, sir, tea or coffee?
Tea.
Great. So that is for the first session, and we'll be meeting you soon for the second session and with a new guest. Thank you, Dr. Pradeep Vaideeswar.
Thank you so much. Thank you.